Good evening, everybody. Welcome to night 4 or Thursday night of Facetté Medical Spa and the Hair Experience 5-year anniversary. As you can tell, I'm running a little low on energy. Just kidding. I've got it all here for you guys. We're so excited. This is going to be such an incredible night, and I can tell you, we are all so looking forward to seeing each of you in person tomorrow. So looking forward to it. Just like each and every night, we're just getting set up for you guys. We're going to give everybody a few minutes to get on because sometimes we forget to register for the Zoom, and I like to give everybody a couple minutes. Please make sure to use the chat option, pull up the chat bar so it's up. This is a great way for everybody to ask questions. We can interact, and it just keeps everything rolling. I love that we always have great commentary going on in that space, which is awesome. Tonight we have a lineup for you that's going to be great, and I have some things to share with you, which is going to be great. And so it's just a fun night. A reminder that we are supporting our nonprofit this year is for the Alliance for Suicide Prevention of Larimer County. You can find their link on our website. When you donate, your name gets put into the drawing. I can tell you the girls worked incredibly hard today, putting all the names in the drawing. It was so fun to see the long list that we were continuing to add for the big drawing tomorrow. Oh, thank you all. My bestie Molly, who is my glam squad, came and gave me some sultry eyes and a high pony so we could have it be a little fun and a little wild tonight. So I love it. And I'm really looking forward to tomorrow. Mina found a picture of me like hugging my red carpet, and I was like, we haven't had the red carpet out in so long. I'm ready to roll out the red carpet and have our friends here again. So it's so exciting to be able to do that. All right, so we're gonna go ahead. Thank you guys. It's been fun to have different looks. Yeah, I love the team is so amazing, and I'm like, just do what you think, and we just have a great time taking care of each other, which I love seeing that. All right. Oh, I see we're already ready. So we are gonna go to the girls. We've got Mina and Kathy there.
Yes. Hi, how are you?
Hi, I'm good. How are you?
Good. Well, we got something pretty cool. So we have never done this as a demo before. We just kind of chatted about it. And we're going to you know what, let's just step it up this week and let's do something different. Yes. So what we're doing, I'm here with the amazing, wonderful, incredible Kathy, who is our PA that specializes in bioidentical hormones. Kathy has been doing hormones for about 10 years. Is that right? 10 years, yeah. So very, very long time. She is above and beyond the #1 specialist about hormones. She can answer any questions because, as we all know, hormones are very complex. It's not like not everybody's the same dose, and not everybody needs the same things, and not everybody responds to hormones and different medications the same way, right? Yep. And so Kathy knows it all. And so I'm just going to hang out and ask Kathy a couple of questions about it, and then we're actually going to do a demo. So if you're queasy, then please just look away. But it's actually really cool to see. So to actually see what it's doing. So first of all, Kathy, I'm so glad you're here and that you're with us. And we want to know first, why would somebody want hormones, and who's the candidate for it?
So we have the 2 types of hormones, testosterone and estradiol. So for younger people or anyone any age, if you're fatigued, have low libido, low sex drive, sometimes it's anxiety for the males, you're a good candidate for testosterone. People who are postmenopausal, who have vaginal dryness, hot flashes, night sweats, even osteoporosis are a great candidate for estradiol because they can bring the bone density up and resolve all those issues.
Fantastic. Now, what would you kind of mentioned this a little bit, but what would your symptoms be? So if you have low testosterone, say as a man, what are your symptoms typically?
Well, interestingly, besides fatigue, anxiety in males, low sex drive, you can have more joint pain, have a hard time with erections, things like that.
Okay. And when does that start happening for males? Like when do you feel like generally, I know it's different for everybody, just like we said, but when could that start? How early?
Probably in their 50s. Yeah,
Okay.
normally around the 50s, some people earlier, some people later.
Okay, gotcha. And then for women, we kind of all know about like perimenopause and postmenopause, like when would that we feel like we would start losing our testosterone and or estrogen?
Well, a lot of people, again, in their 40s or 50s, but I have people that are in their 20s
Wow.
who have those symptoms. So pretty much any age.
Yeah. Okay.
That
And that's really
comment.
good. So if you're feeling like these symptoms, like, wait, hey, maybe that might be me, then definitely what we do first is we bring you in, you have a consultation with Kathy, but actually before that, we do your blood draw. So we want to do a blood draw on you first. And that way Kathy can really see where are your hormones sitting. We also check thyroid, which is great too. And after those labs get back, then you meet with Kathy and then she'll sit down with you. And what I love about Kathy is that she takes her time. So it's going to be like a good hour and a half appointment that first time. She's going to go through what your labs look like, what your health history is, and you're going to prescribe the correct dose for each person.
Yes, I do also the thyroid with it,
Mm-hmm.
but I think it's really important because we're putting something in your body. So I explain everything, how it works, the physiology of it, everything to the patient.
Fantastic. And now there's different ways to get these hormones, right? So we've heard of like patches and pills and injections. And so what we do here is more like the pellets. So kind of describe it what the pellets do.
So pellets are bioidentical. All that means is when they break down in your body, the molecules they break down to look exactly like what's in your own body. So you don't have an allergic reaction. They're actually derived from yams. It's the same molecular structure from yams. They have no gluten or lactose in them. So it's safe for people with celiac or any allergies.
Fantastic. Good. Well, you guys ready to see the procedure?
Yeah, I think let's do it.
All right, let's do it. Okay, so
and our intention, right, with showing is to make sure you can see like this is a simple procedure that's in office, right? And I feel like at some point in time, we bought into some kind of like crazy lie that, as we get older, like we talk about hormone replacement as women more, I think, than men do, but we bought into some lie that like, oh, it's normal. We're just gonna maybe feel like crap and have hot flashes and not feel like ourselves, but we don't have to have symptoms and feel yucky. We have options. And I think that's what's awesome.
Yes, absolutely. All right. So we're going to go ahead and start with our client here. And what I will say is that she's already had lidocaine injected. And so go ahead, Kathy. And so the lidocaine, you might be able to see that little bit of a kind of a ridge on kind of the top of her little booty. And what that is basically, so this lidocaine, she can't feel a darn thing. So this is that little incision that Kathy is making. And that basically just enables the trocar, that's what this is. Again, how comfortable are you? Are you comfortable? She's very comfortable. Can't feel a darn thing. And I've had this done by Kathy and I cannot feel anything. She is so stinking good at this. So basically, and fast, yes. So the choker's in, and this are the little pellets. So we talk about them being about the size of a grain of rice, and the testosterone and the estrogen is even smaller than that. It's like sometimes just a little sliver. And so she puts in that estrogen and that testosterone. And then we always kind of describe it. There's different ways to describe it, but one of the ways that always kind of resonated with me was talking about how it's just like a kid licking a lollipop, right? So now it's all pushed in there and she's got it done. And then she's going to just a little bit of blood, not a big deal. And then she's going to put a little pressure there and then she's going to go ahead and clean her up. And so what we talk about is like the estrogen, the testosterone, it's like a kid licking a lollipop, right? So your body's just taking it off very slowly, different than creams or injections, where if you looked at your blood level, say with testosterone injections, you would see like it peaks and valleys, right? where this is going to give you the most consistent level of your hormones. And you're going to burn through it differently for how active you are. So if you're somebody that, doesn't work out that much, your testosterone and or estrogen may last a little bit longer. If you're someone that works out 5, 6, 7 days a week and you work out heavy, then you're probably going to burn through it a little quicker. So then I want to show you this one last thing because she's got it touched on there. Go ahead. And then so she's put the little steri strips on there. And that one thing I do want to say, sorry, Kath, is that little bit of swelling that you see above the steri strips, that's just the lidocaine. So I don't want you to feel like that is the pellets or anything like that. It's just that little bit of lidocaine so that our client was super comfortable. And then she's just going to put a little pressure patch on it. That little incision was, I don't know, a centimeter. Is that about right, Kathy?
So small.
Yeah.
So small. And then, and that's really it. So that's kind of the procedure for that.
Yeah, there's a few questions, right? There,
Of course.
There's a few things of, can we talk about the risks, especially to estrogen? Obviously, we
Yes.
know that there's some interesting, thoughts around what that looks like.
Yeah. And I'm
And
going to
then
have
the other-
Kathy address. Oh, go ahead.
Yeah. And then the other one was, that with the pellets, that if you don't like it, right, you can't get it out. Because they're inserted. That being said, Kathy has an additional 4-year certification for the hormones. I think the thing is that anything that comes to hormones is it's about like the dosing and what that looks like. And we work really hard to make sure that that is on par so that there's not issues with that.
Right, absolutely. So one of the questions is the dangers of estrogen, and if you want to address some of those things about the concerns about people that might have history of breast cancer or family history of cancers.
Okay, so as far as someone who's had breast cancer, especially if it's estrogen receptor positive, we do not want to do estrogen. However, we can do testosterone pellets, and we have an anastrozole pellet which blocks testosterone from going into estrogen. And we can do that on women who've had breast cancer,
Okay.
and it resolves their symptoms, gives them energy, libido, and takes care of their hot flashes.
And it's important to note that estrogen, the pellets don't cause breast cancer, right?
I can explain that.
Please do. Yeah.
White Pharmaceuticals, who made PremPro, did a study, the Women's Health Initiative study in the 1990s, and they're using Provera, which is synthetic progestin, and Premarin, which is estrogen made from mixed horse's urine. So they stopped that study 5 years after it started because the women on PremPro had higher rates of breast cancer. Everyone said all estrogen is bad. They changed all the protocols. Well, in 2017, JAMA came out with an article that they reversed the findings of that study. The women who had just Premarin, their breast cancer rates went down, and all-cause mortality went down. We believe it was a Provera that was causing the blood clots. I've done this for 10 years. I've maybe seen 4 or 5 people.
Yeah.
It's
Yeah.
very
So it's
rare.
definitely different. There's a lot of misconceptions out about that. So, and Kathy can go, if you have a consultation with Kathy, she can go into as deep as you need to and give you all the articles and all the research and that evidence-based practice to support why estrogen and testosterone really are so great and work for almost everybody. And then what was the other question, Amanda? I forgot it now. You can't take it out. I remember. So it's because it's in there. If you don't react to it well or don't like it, you can't take it out. So what do you think?
So one thing that I'm always very conservative because I don't want people to hate me. So we start low and you can always add more.
right.
So
Yeah. And
Yeah,
I feel like everybody does really well with it, right? Yeah.
they do well. I had people come back. I get their labs done about 4 weeks after I do the insertion, have them come back at 5 weeks. And sometimes they need a little booster, sometimes they don't.
Yeah.
But
Yeah. That's perfect.
Well, and some of the questions are like, does birth control affect your blood work and your testosterone numbers? I mean, as women, our hormones change frequently throughout the month, right? They can go up, they can go down. This is normal for us. But we have all of the information. Kathy has everything that can take that into account. So she knows exactly how to determine what those tests mean and what it's going to mean for you and how to calculate what your dose will be. They're asking, how long the pellets last. So for women, Yeah.
Yeah, for women, they typically last about 3 to 4 months. And for men, they can last about 6 months. But it's because we're putting in so much more testosterone for men than we obviously would for women. So it can last longer.
Yep, absolutely.
Mhm. Yeah.
It's just they're asking a lot of questions about, can it help with balancing hormones with PCOS? I mean, really, when we're talking about balancing hormones, it's going to help with any reason that you would want to balance your hormones. And
Yes.
I was diagnosed with PCOS when I was 15. I'm going to talk about that a little bit more later, but having that balance and being able to help your hormones helps us all feel better, no matter why they're out of balance, whether it's menopause or PCOS or thyroid or whatever it is, getting that balance makes us all feel better.
Yes, for sure. Absolutely. So yeah, so I think I know there's a lot of questions about hormones, so definitely
Yeah.
encourage you guys to come in and see Kathy for a consultation. Get your labs drawn if you're not feeling great. It's I think it's easy for women today and in our society just to be like push it off and push it off until we feel really, really bad, and then we feel like we can't push it off anymore. So I encourage you not to do that way, and to really, if you're feeling like, gosh, I do feel like more anxiety and more depression and low sex drive, a lot of those things have to do with hormones. It's not that all of a sudden, we get depression in our 40s and 50s, even though that can happen, but a lot of times it really is more related to our hormone levels than anything else.
Yeah, it does. Several people are popping in here saying it helps me sleep better. It helps my energy. Yeah.
Yeah, go ahead, Kathy.
So a couple of the benefits of estrogen, if started early in menopause, studies show it helps prevent dementia, which is huge. And also bone loss. I've had people who've had osteoporosis and I've given them estrogen and their bones have gone up into the normal range. So those are pretty significant things, because falls and breaking bones when you're older is one of the major causes for mortality.
Yeah, for sure.
There's
Absolutely.
some definite preventative benefits. Is there any reason that someone who has previous blood clots could not, or would there be any counterindications for that?
What about with blood clots, Kathy?
So pellets are transdermal. They're just like a cream or a patch. They do not go through the first pass of the liver where the blood clotting factors are made. So you're at no risk of a blood clot with this method. It's not the estrogen that gives you the blood clot, it's the route.
See how smart she is? I mean, like, holy smokes. I didn't know that. That's amazing. So she knows all the details. Give us your hardest question and Kathy will know it.
The best thing really, and the reason why we have you do your blood work first is so that we can talk all day about like how we don't feel good and how it's a benefit. But the best thing to do is get your numbers. Let's look at your numbers and how you're feeling and see how we can optimize your hormones and make you feel better. I will tell you guys, Kathy, I'm gonna say Kathy saved my life, because I had doctors that wouldn't listen to me about my thyroid and they thought I was crazy, tried to put me on all sorts of other things. And Kathy ran deeper tests, figured out my thyroid stuff, and helped me dig that out. I cried and she was like, it's no big deal. But for me, it was a big deal to have someone who listened to me, would treat my symptoms and help me figure out what I needed to feel better. That's important in a provider that you're looking for, especially when we're dealing with special things like hormones. And she is one of the smartest ladies I know.
For sure.
Yep.
Absolutely. Good. Cool.
Well,
and then the other thing we want to talk about was
vaginal rejuvenation.
Yes, absolutely. Yeah. So what I'm wondering, Kathy, do you want to take the mic and do that?
I'll try.
Yeah. And talk about that a bit. Does that sound good? Okay. I'm just going to switch this. We're going to switch real quick and switch mics. I'm going to put this around your ear. There you go. Is it in there? Yeah. Okay, cool.
Okay, good. We can hear you. Hi, Kath.
Hello.
Hello. So we're going to talk vaginal rejuvenation now. And I've been saying all week how we have to take care of all of the skin on our face and all the places. Everybody's been teasing me because that's what I said. But let's talk about the benefits of vaginal rejuvenation. Sexual health is huge right now in our industry and super important. So tell us about our treatment.
Okay, so again, after menopause, everything gets very dry. You can get vaginal laxity from even childbirth. You can get urinary tract infections because you get little micro tears because there's no lubrication there. So what if the estrogen does not work, which a lot of times the estrogen will work for that, but if it doesn't, or if you've had breast cancer and you can't get estrogen, testosterone does not help with vaginal dryness. So what I recommend is the V-Lase. So what that does, it makes mild heat injuries to the vaginal mucosa and underlying tissues, which causes new collagen, elastin, and blood vessel formation. So that can bring blood to the area, thicken the tissue. It can help urinary incontinence, the laxity, sensitivity, and
Mhm.
dryness.
Yeah. And she's talking about like the heat wounds, right? So that sounds a little intense when we're talking about, vaginal rejuvenation, but I've had the treatment myself. All of us at Facetté have had the treatment. And it really, there's no pain. There's some
No pain.
little bit of heat at the very end that you feel. There's really very minimal, if not no downtime. And it does. The first time I had the treatment, I feel like it helped my incontinence significantly after having 3 kids, and made a huge difference just, I feel like, in that space alone. Oh, did you saw me?
Another thing, it is a non-ablative lasers.
Yeah.
There are different type of lasers. So what's great about that is you don't have itching, burning, bleeding afterwards. You just have to abstain from sexual intercourse the night before, and that's it. It's
That's
really,
it.
there's no downtime, which is
Yeah.
wonderful.
I've done
You're
it.
in-
It's so easy.
It is so easy. You're in office for the procedure about 45 minutes, but it really doesn't take that long. It's more like the prep and getting ready for it. It's a very simple procedure. We recommend doing a series of 3, one about a month apart for that first series, and then maintenance as you see that you feel like you need it. I would say most people come in probably once a quarter, once every 6 months, just depending on what your needs are. It helps of all ages. I would say anybody who's, even after you've had a baby, like that's dramatically different. The promotion is it's a series of 3. So the package is 3 for $1,500 for the V-Lase. And that's what we're doing there, which is $500 for each. And you can come in and have those back to back and see and feel that difference. We all have done it here. You can ask any of the girls about it. So
It's a great price for it too.
it is. It's absolutely a
Yeah.
great price because we've seen it upwards of $1,000 to $1,500 per
A
treatment
piece.
a
Yeah.
piece. So to have it at that rate is an incredible rate. So that's awesome. Kathy, should we talk about peptides?
Sure.
Yeah, let's talk about the peptides. So one of the things that we've introduced, and I have been excited, Mick, it would help you too. Mick was asking a question about incontinence. As we get older, all those things happen to all of us, regardless of having kids. So yes, it will help with that, even if you haven't had kids. One of the things that we have introduced at Facetté this last year is a medical weight loss through peptides. And it's an exciting breakthrough, in my opinion, for so many reasons. But on the medical side, and Kathy and I've talked about this for many years, there has not been a lot of options for weight loss that weren't stimulant based, that could impact high blood pressure and other organs, right? Like there's so many medications out there that they tried to prescribe that could impact other major organs, or that were so dramatic, right, that you would lose a significant amount of weight in a short amount of time, but then the long-term effects weren't necessarily there and could impact your metabolism in a different way. And so the FDA has approved medications now for weight loss that were previous medications that they used for diabetes. And we have a compounding pharmacy that we can compound them with. And we started testing them to see how they worked and are excited to bring them to you because of how safe they are. And super excited. I'm going to share my story with you guys. We're going to talk about the science a little bit first, and then I'm going to show you some pictures and share my story of how it has come along and helped me. And so do you want to talk just a little bit about the science of the peptide weight loss? Yeah.
Yeah. So everyone produces glucan-like peptide 1 in their small intestine. It goes to the pancreas, increases insulin biosynthesis, protects the beta cells that produce the insulin, It goes to your muscles, makes them more sensitive to insulin. Studies have shown it's cardioprotective. It increases cardiac output. It is neuroprotective. They think it works on the appetite by increasing the leptin sensitivity in your brain. And then it goes to your tummy and slows gastric emptying, so you feel full longer. So basically, semaglutide is a GLP-1 receptor agonist. It's a lot stronger than our own.
Yeah.
So when people take it, they're not hungry when they eat. They can only finish half of what they eat. They don't have to deprive themselves, which is really nice. It's, we can pick your own diet. You just don't want to eat much. So along with the diet and exercise, it's just, I've seen fabulous results.
Yeah, the results are incredible. And I think one of the things, cravings are huge, especially when we're talking about, regardless of where we're at age, or when we're talking about hormones. It could be PMS, it could be menopause, it could be anything that our body is being resistant to losing weight, and our body can create issues where it becomes resistant. But being overweight creates other health issues, right? 43% of people are overweight, and a third of those are pre-diabetic, and diabetes has definite, or prediabetes has definite indications for hypertension, stroke, heart attack, cancer, autoimmune. There's so many things that it is a precursor to. So keeping our weight lower is much healthier for long term, especially those big things that are the big determining factors from the CDC of like chronic disease. And so having something that is safe, that doesn't impact other organs, and giving us the ability to lower our weight and have longer term effects keeping it off is incredible. Most people, like you said, Kathy, talk about how they are happy that they don't feel like they think about food all the time, that they're not craving food. They feel fuller longer. The diet, I'm just going to talk a little bit about, you guys, kind of like how it works. You still need to be mindful of your food, your diet, and your exercise, just like anything else. We talked about that with Cool Sculpting, right, this week, that we can eliminate those fat cells permanently. But if you were to go back and start eating unhealthy, the other fat cells you can still gain weight, and those other fat cells can still get bigger. And so it's so important as a piece of doing this diet is that you would maintain still a healthy diet and exercise, and you can decide what diet is best for you. That's not something we're going to tell you. Most of us have different things in our situation that make it what needs to work for you. We're not going to tell you, but you do need to do something. So it's up to you. There's no weird foods. There's no strict diet. This is based on what you choose to do. It needs to be healthy eating, which typically means we need to be mindful of our calories, our fat intake, our carbohydrate intake, our sugar intake. Those are just normal things that we would talk about when we talk about healthy diet and healthy exercise. It is, the peptides right now that we have in the program that we're utilizing is a semaglutide and B12 compound. And the reason that they compound it with B12 is to help offset some of the side effects. Some of the side effects can be, and this does not impact everyone. We've seen it, Kathy, where some people have no side effects and some people do have some side effects. You can feel a little nauseous. You can have some stomach issues, maybe a little diarrhea. I will tell you that the side effects have never been so bad that I've seen someone stop doing the program. That typically we find a way to manage them. We always start at a lower dose and titrate up to make sure that the side effects are lower so that we don't have to have those side effects. And then, of course, we just continue to do it. It is a once a week shot. And I'm just going to tell you how we do it here. You would come in, you would meet with Kathy. We would talk about what the program looks like. We do a cardio panel of blood work, just so that we have a baseline to know what's happening in your body. How's your A1C? What do those metabolic markers look like? Just so we have that baseline. And then we would order the medication for you. It's shipped to your house. If you need us to help show you how to do a shot, it is the tiniest needle. You don't even feel it. One shot a week, that's it. And then as it starts building in your system, you start feeling like you're not eating as much, that you are not craving as much, you feel fuller longer, or you get fuller faster. That's why it's important that you eat the right foods, because if you're eating all the bad foods first, that's all you're going to eat because you don't feel hungry anymore. And so it's so important to eat the right foods in that space. It's been really incredible in that space. So Anything that you would add to that, Kathy, about side effects or?
Well, yeah, one of the things, the side effects are transitory. So
Yep.
usually they last maybe 2, maybe 3 weeks, and then they resolve. And everyone has my contact information. I just want to know that people have support, you know, so if
Yep.
they have a question about anything, I try and get right back to them.
Yes. And she does a great job. And we can all support here too. That's the great thing about having an incredible team, is that we can share each of our stories. The program really depends on how much weight that you need to lose, but I would say that this is a low and slow process. And what makes that even better is that when it's low and slow, that means we're going to have longer term success. So it typically either between 3 and 6 months, or between 6 months and a year that you would be on the program, depending on how much weight you need to lose and how long it takes. Some people lose faster, some people lose slower. It just depends on your body and how that works. You can use the bioidentical hormones and peptides at the same time, because they're going to work hand in hand. You want to optimize your hormones so that we can make sure that as we introduce the peptides, you're going to continue to do that. So I'm just going to share my story a little bit here, Kath. I was diagnosed when I was 15 with PCOS, had problems with it long time, lots of hormone things up and down. I've dealt with autoimmune things over the years and have just continued to plug away at it. Many of you who've only met me over the last 5 years have only seen me probably heavier, but before that, this is more like my normal weight. And I'll show you guys some pictures here in a second. And I started working with Kathy again and getting like my hormones back on track. I had a hysterectomy because that needed to happen, and start feeling healthier in that space. Changed my thyroid medicine, and I was already losing weight, which was the first time, you guys, in 5 years that I was able to lose weight, but it was very slow. It was like maybe a half a pound, and I had lost maybe 30 pounds before I started on the peptide. I introduced the peptide and I started losing about a pound a week, maybe a pound and a half a week, and just continued. I've been on the peptide now for over a year, and have significantly lost weight, but I have noticed a huge difference because with the insulin resistance, I can tell that my body's actually functioning better. And you can tell it helps your body work with itself as opposed to working against itself. And that's what's so great. I had one lady call and she's like, this is a game changer, because I was the same. I'd been doing so many different things to be eating healthy and being so good and not cheating, but I still couldn't lose weight. I was still actually gaining weight. And a lot of it because obesity is an inflammatory disease. And so I had a lot of inflammation from autoimmune anyway, but then on top of the weight, this helps bring that inflammation down and uses your insulin so that it's working with you, if that makes sense. I'm going to show you guys a few pictures here really quickly, because I know that's always a question. And I said I would.
I have another thing to add, Amanda.
Yeah, go ahead.
So especially in menopause, many women gain weight when they're going through menopause. And I found out my last conference, estradiol is a GLP-1 receptor agonist too. So when they lose the estradiol, that's not the whole reason, but a lot of the reason. So it really works together.
Yeah.
With the hormones.
Well, I feel like all the hormones should work together. That's so important. Let me pull this up. All right, so here we are. Oh, why is it not showing? All right, here we go. All right, here we go. So this is Mina and I. You guys, in a couple weeks, I will be turning 46. And this picture was taken 6 years ago at my 40th birthday. This is where my weight had been, which is very, very close to where I am now for years and years and years. And so this is where that was. And then we opened Facetté 5 years ago. There was a lot of stress. I had chronic fatigue and was diagnosed with RA. I started taking a biologic medicine that messed with how my hormones worked, and also just my metabolism and what some of those things were. And then I started gaining weight. This picture was at Taylor's wedding, and that was June, almost 2 years ago. And you can just even see in my face, just very swollen, lots of inflammation. I had continued to gain weight no matter what I had done. It was very, very frustrating and challenging to feel like you were doing something, but you couldn't lose weight. And that's how we feel in menopause or when things are out of order. And then this was me just a couple weeks ago out to lunch with my friends. So you can see I'm back in that space. And my intention was sharing, like where we started and where we were. This wasn't, so much just wanting to lose the weight, but also getting back to a place that's healthy for my joints, that's healthy for feeling better. And the peptides have made a huge difference in not just me, but like several of our clients' life. It is an easy program because you get to pick your own diet. You do get to do those things. I've been able to put on muscle, lose fat, but I've been very intentional with what I'm eating and continuing to do the peptides. A few things, thank you. I do not know. Actually, I've been doing a lot of alternative therapies for my RA, and I have been off my RA meds for almost 3 years now. And because I think there's other ways around what that was. It did help me get my RA better, so I wasn't in so much pain, but this is definitely making a huge difference. It is a shot, but it's a super easy shot. The side effects are manageable and they do go away, which is great. There is a lot out there, you guys, with semaglutide talking about like how it makes you age faster and how you will look older. The fact is when we lose fat, this is what we've been talking about all week with injectables. When we lose fat from our face, we do start to look hollow and older. So if we're losing weight, it makes sense that we might have to do some things to our skin and to help fill that in because of what just weight loss in itself, that is a normal thing. And then afterwards, there's always the question of like, what do you do after? And that depends on how much weight you need to lose and what that maintenance looks like. You should be able to stay on it after you stabilize your weight for a little bit to reset that weight point and then be able to come off. And as long as you are still eating healthy and doing the right things, the weight should stay off. 85% in the study stayed off as long as they stayed on an incredible, if they were still eating correctly and had support and help in that space. You can finish the shots and do that. I can tell you, Kathy and I have been changing some things up for me, and we were reordering some things and it's been backed up. And so I haven't had my shot for 3 weeks. I have still continued to eat healthy and I haven't gained any weight. It is maintainable for sure. And they see 85% of that can be maintained as long as you continue a healthy lifestyle. So what we love is that we have an option that is a healthy option that is FDA approved to be able to help people feel better and lose weight, be healthier and avoid prediabetes and heart disease and stroke and cancer. And we're going to continue to introduce more and more peptides into our program here at Facetté. We talked about peptides for hair loss. There's peptides for sexual health. There's some cool things that we're going to be able to continue to bring into our world, which is super exciting. What would you add, Kath? I know I said a whole bunch right there.
Well, I'll just say I've been practicing for 22 years and I've never seen anything like this.
Yeah.
I've never seen anything work so well and be so safe. So I've been extremely happy.
Yeah,
my patient's
it's been
progress.
really, really incredible. So monthly cost as of right now, and this cost is based on the cost of the medicine as well. So I've seen a price increase, but we wait and see what happens with that. Right now it starts at $375, and that includes the medicine for the entire month and your appointment with Kathy. And then each month we have you meet with Kathy just as a check-in. We check statistics, we see how you're feeling, making sure that you're doing well, that you're on the right dosage. And then you continue to titrate up. When you get to the highest dose, it is $450 per month. And then you continue until you make a plan to maintain and have long-term success. So that's what's exciting about it. And Kathy and I agree with Kathy. It's been great to see and have an option to provide patients that is a safe, healthy, long-term option. So it's been exciting. Yay. All right. Well, thank you, Kathy, for sharing all the things with me. And
Thank you.
yes, thank you. We are going to get ready to go see the Hair Girls, which is so awesome. Yeah, I don't mind sharing with you guys. So there's a few questions here really quickly. PCOS is polycystic ovary syndrome. It is a syndrome that can happen within the hormones and ovaries and things like that, which ultimately led to my hysterectomy. But I was blessed with 3 amazing children who've been awesome. And it was a long journey, but I'm grateful for what I have. RA is rheumatoid arthritis, which is an autoimmune arthritis that impacts your joints. It's degenerative. It does not go away and continue. It can be very painful. It can have flares. But I have done so much research. I've changed my diet. I have done some alternative therapies, which has helped with that. I have hypothyroid, which is an autoimmune disorder. And I have had chronic fatigue more than once. Actually, I think 3 times at this stage in the game that has impacted and actually they think started my RA. But autoimmunes are like that. They're kind of like, they like to live together. I'm very grateful. You guys for 3 years, I feel like I have been in remission and been healing and grateful to have been able to lose weight and working towards something that's great. And I share all this so that it's because I love that we have the peptide that we can share. So lots of people can lose weight. But then there's great things that are out there now for people who are really struggling with other ways. And so it can just help all the things. It's not just a size in your pant, because I think it is so important to talk about the health benefits of what that is. The first time I've lost weight before, I lost over 100 pounds. The biggest thing I think is that was when, and my kids were little, is when I read a statistic that said that the life expectancy of a woman who was overweight at the weight that I was had the same life expectancy of a woman who had untreated breast cancer. And we throw the word cancer around a lot because it's scary and it's overwhelming, but we would never not treat it and what those things look like. But when we allow our weight to creep up on us and not handle those things, it really can lead to other long-term health issues. And it was important for me to make sure that I maintained that and took care of myself so I could take care of my kids and continue to create a legacy of what that is. And so I share all that because it is great to feel good and to feel better in our own skin and all of the reasons, however we get there from the outside in or the inside out. I think it's important we get there and we get there healthy. So I just wanted to share those things with you guys and why we brought peptides in. I'm really excited to be able to offer that. We were one of the leaders in offering that here in Northern Colorado, and we're going to continue to do that. So, all right, we will, you guys can message me, or if you want to have questions or want to ask me questions, please know you can come grab me at the spot anytime. I'm happy to share. But we're going to move on because we're a little behind. I knew the peptides would take over a little bit, but that's okay. We're going to go to the girls on the hair salon side because we have our question and answer panel with all the pretty girls from the hair side. Hi, ladies.
Hi.
Hi.
How are
You
you
guys look amazing.
Thank you.
Can
You
you hear
look
us
amazing.
okay?
Oh, thank you. I have a whole like beauty team that takes care of me. Look at me. All right. So are we ready to talk hair?
Yeah, we're so
Okay.
ready. Yes, we were just listening in on everything and it's just amazing. All the transformations and just feeling good. And that's what it's all about. So
It is.
Um,
It's been awesome.
I've been on a couple nights this week, but I'm Lauren. This is Bailey, Taylor, and then Paxton. And we're here to answer all of your questions. We have some that were submitted on Instagram that we can kind of get to, but our priority is whatever questions you guys have for hair. So you can go
love
ahead and
it.
type them. Yeah, you can type them in the chat and then we'll just kind of go through and answer.
And we do have a phone up here to read the chat,
Mhm.
but Amanda can also read them out loud. So we'll try to keep looking up and down too.
Let's start with the ones that we got from social media, because we did ask on social media, like, what are your questions? Do you guys have those questions that we can start with as they start coming up with their own?
Yeah. So the first question that someone had asked on Instagram, the difference between highlights and balayage.
That's a great
So-
question.
Yeah, I feel like balayage is just like a buzzword and it can be thrown around in a lot of different ways. And no one actually always knows what it is and what that looks like. And so really it is, highlights are going to be to the scalp most likely, whether you root your hair after anything like that, it's all going to be to the scalp. And it's going to be more of like a blended look up top, and you can do anything from chunky highlights, which we've all been there, or blended, anything like that. And then, yeah, balayage, if someone else wants to take it.
Thank you.
Yeah, I was gonna say kind of how you touched on how it starts at the scalp for the highlights, kind of just blended, starting maybe mid, slower maintenance, and then focus more on the ends.
Very sun-kissed and natural.
Yeah, that's perfect to say that.
Yeah. Yeah.
I
And
love it.
then the next question was, do you have to curl your hair to blend the balayage? So with any hair color, if you wear your hair straight or curled with a curling iron, it's going to look completely different. So you can have a balayage or a highlight that is more chunky, and it's going to look super chunky when it's straight. When it's curled, it's going to be a little more blended. So curl is going to kind of diffuse and hide some things a little bit.
One of the questions that popped up was tips for keeping moisturized. I mean, this is just, it's Colorado. What do you think?
Sorry, I didn't want to talk over anybody. But the tips for keeping your hair dry, obviously, great product will be your best friend. You treat your hair how you want to be treated. So as long as you get nice moisturizer, we have treatments here at the salon. You can get nice blow dry style. It's a little treat for yourself, little treat for your hair, or you can always trust your trusty hairstylist to put you on the right path to getting your hair looking real good.
Yeah. And we have a
Yes.
bunch of in-salon services as far as, like she said, treatments. We have great products we can prescribe you, and some glosses for shine and moisture.
And
Yes.
it really depends on your hair type, because obviously someone with thick, coarse hair is going to need a different type of moisture than someone that's fine hair, but still needs that moisture. So we have so many options for all the things.
All the things. What are 2 top pieces of hair advice for keeping hair healthy?
Will you say that one more time?
What are 2 top pieces of advice for keeping hair healthy?
I would say one of the ones is at-home care. So making sure you're using at home what your stylist recommends. The products we use are at a certain price point because they are quality product. And that means it is going to protect your hair, make it long and healthy, keep the shine, keep the color, and that's super important.
I was also gonna say regular trims as
Yes.
well, just kind of keeping up with cutting it, just so preventing those split ends
Yep.
and everything.
Yes. What hair trends are you guys seeing? What's changing? We were just talking about hair trends today, Taylor. So what are we seeing that's
know.
coming in the world? that
Yeah.
is shocking us?
Everything-
Warm, golden,
Yeah.
sun-kissed, everything natural is
Yeah.
in right now.
Yeah. Very
Yeah.
lived-in looks, like very blended, something you don't have to maintain all the time. Is still in, just like balayage has been around for so long, but it's definitely a different look. Like we were talking about highlights versus balayage. It's definitely kind of a combination now of both. So you can still have the brightness up top, and still have a blended root, which I think is super pretty. It's been kind of evolving over the last few years, but then definitely golden blondes and more honey. And I think we'll see a lot of that this summer. We just took a really cool class a couple months ago on some warm blondes. So
Oh, yeah.
yeah,
It's gonna be beautiful. If someone wants to go lighter blonde, would you recommend highlights or balayage?
If someone say that one more time.
If they want to go lighter blonde,
I would recommend a consultation because it depends on where you're at.
yes.
So balayage, the thing with that part of it is you really can only get a couple levels of lift with true balayage, which is hand painted on the hair.
Yeah. it's more
And so what we'll do
sun-kissed.
is what's called foliage a lot of times, which is kind of just a hair term it's kind of a buzzword, if you will. That we do a balayage technique, so you have that look, but it's in a foil. So there's lots and lots of options based off of what you're wanting. So
Love it. How often should you wash your hair?
Every 3 to 4 days with hair extensions.
every 3 to 4 days with hair
Yeah.
extensions.
What would you say
and
for natural hair? What is your opinion?
twice a week, 3
Yeah,
times a week.
I was just
maybe.
gonna
Two or
say
three
not
times a
every
week.
day,
Maybe
but
Yeah,
twice
yeah,
a week, yeah.
somewhere around there.
If you can get away with every other day, because I know some people struggle with that, that's good, but
Yeah.
2 or 3 times a week with natural hair.
Yeah, and a tip for keeping yourself longevity a lot longer is using a texturizing or a dry shampoo, even on clean hair, because
Yep.
it's just gonna attack those oils right at the get-go, and you're gonna have a lot of longevity.
Yep.
To having healthy, clean hair.
It's a game changer.
Yep.
Like today is day 4 for me. Like I'll have to wash tomorrow, but today's day 4. Who's our pixie expert?
Michelle and Lauren.
Michelle and
Lauren.
I do
Lauren.
a lot of pixies. I do, and I love them. I think it's so fun.
They
But,
are fun.
Yeah, I feel like with pixies, everything's super customizable. Like when in the past, when I've taught our new girls like the pixie day, it is super fun because I think there's a lot of times we have this vision of short haircuts that are like dated and everything, but really there's so many cute looks with.
Oh,
within
so
that.
many. Okay, this is a great question, I think, too, because we always talk about one of the most important things for our hair is heat protectant. So should you apply a heat protectant every time you apply heat or just after washing?
There's a few different products you can use. So if you've just gotten out of the shower and you're about to blow dry, we have thermal protectants you can put in your hair. If you're on like day 2, 3, 4, we have some sprays such as Mystify from Orbe, which reactivates your style and protects your hair from any thermal damage. And a lot of the Orbe hairsprays have thermal protectant up to 4-ish,
450,
450, I believe.
Yeah.
Yeah. But you want to
I
make
do.
sure you're always using one at least before you blow dry. I would still recommend using something like Mystify
Yeah.
for that dirty day style.
We
Yeah.
do have one product too from Kerastase, L'incroyable. That's kind of like your all-in-one,
I
and
love
every
that
time
one.
you use heat on your hair, like the days after, that heat protection is reactivated. But that is a common misconception because that's not the case with all heat protection. So
Yeah. Okay. Well, we have to wrap up a little bit and go to the next one, but I have one question that I would love for each of you to answer. What was your biggest moment so far being a stylist?
Biggest moment.
Each of you should answer.
I would definitely go.
All right, Pax.
So she was like my first client a few months in. She was an extension all over color, just kind of was like, you do what you gotta do to like make me feel young, beautiful, pretty again. And I did it and just tears
Yeah.
just erupted. And that was like really reinforced into myself that I really am doing what I want to do. It's really for the other person, the people that I can do just little things. And I'm like a little magician behind the chair being like, just gotta do bibbity boppity boo. Literally, and you can change somebody's entire perspective on themselves, but a foil or two. It doesn't even have to be a lot. Like from our transformation earlier this week, we added maybe 10 foils and they were mixed matched in colors, mixed matched in bleaches, and it completely changed the entire look. There's just little things that a professional can guide you on to get you what you want without being like, oh my God, I need to spend this much, that much, do this much, that much. And it's really cool that we have the job that we can really just help others every single day.
Yeah, I love that. All right, Tay.
I think for me, it's gonna come down to hair extensions. And it kind of revolves around, I feel like people put an age range on hair extensions. And there's no age range for hair extensions. It is a circumstance, it's your hair, it's what your desired look is. And one of my favorite things is sitting someone down in my chair thinking that they are not the appropriate age for hair extensions, and I give it to them and they feel like a whole nother person. And showing them that they can do this and it looks beautiful and it's easy. And once you get it down, you can maintain it and no one has to know. That's a
No.
nice thing. It can be your dirty little secret.
Yeah, no one will know. They'll never
Yeah.
know. All right, Lauren.
mine is pretty similar, and mine's actually more recent here in my career in the last year or so, with hair extensions as well. I have a client, and I do the mom's hair and the 2 daughters' hair, and the youngest of the daughters is in middle school, really just has always had super, super fine hair, and super self-conscious, and she was getting bullied, and she always came in and she had her head completely down and she would never look at me. And then finally she talked to her mom and they were like, we're gonna do hair extensions. And So we just did one row just for a little bit of length, a little bit of fullness, and the way she walks into the salon now and the way she talks to me and the way I get so emotional.
Yes.
But yeah, it's
She carries
amazing.
herself completely different.
Yeah, it's amazing
It's a
the
huge impact.
transformation that,
Yeah.
yeah, I've seen in her just confidence. So
Yeah.
I love that.
Yeah.
All right, Bailey.
It's kind of similar to everyone's over here, but I would say probably for me, kind of like what Paxton was saying and what you were saying too, about how just seeing how it changes people and how she got emotional, the way she carried herself. But I feel like I had a client at one point who had just gone through like chemo and she had lost her hair a few years back. And finally, when she started growing it out, we gave her a really cute cut and she just got emotional, same situation. And I was just like, oh my gosh, I can make that
Yeah.
impact on somebody. And it was amazing. So I feel like just striving for those moments all the time is just
No,
why we do what we do.
absolutely. And the relationship and why you do what you do is so impactful for all of us. I'll never forget the woman who was like, this haircut changed my life because I finally have the confidence to go after my dream job. And I went for the interview and I got my dream job. I mean, a haircut can change your life.
yeah.
When we find that we feel great about ourselves and can project that outwards, there's so many things that we can do. And when we can build on those things, it's so important. And you change lives. And I think that is absolutely incredible. And each of our team members are so incredibly trained and educated. And that's one of the things that I love sharing the most, is because they love to take that and just give you what you need, which is absolutely incredible. And at the same time, we also get so much from the relationship that we have with our clients. So thank you all for sharing your expertise. You're amazing.
thank
We
you,
appreciate
Thank
you
you guys
all.
for your questions.
Yeah.
Thank you. All right. Hi, girls. To answer your question, all the girls except for Bailey has extensions. She was the one on the far right. That is her natural, amazing, beautiful hair. But the other girls do have extensions. All right. So now, oh, you guys, I'm behind. Do you know what? I haven't done any giveaways. So they're going to have to wait with laser. Rebecca Barlow, you won a vaginal rejuvenation laser. So we can talk about that. Joni Erickson, we have a complimentary hormone consult for you if that is something that you want to be considered for. I have a shampoo blowout treatment for Charity Andrews. And one of our favorite things that we have started having here at Facetté are these incredible satin kits that have a sleep mask, a satin pillowcase, and a satin hair scrunchie for your hair, because we always talk about how satin pillowcase is great for your hair and for your skin, because cotton can pull out that moisture. It can be really rough. Same for the scrunchie and the eye mask to protect your eyelashes. And so we have a beautiful satin kit for Sarah Painter. That is for you, Sarah. So congratulations to you ladies. And without further ado, we will go to our next. Thank you all for hanging in there with us, because we're a little behind, but I think it's important that we get to everything tonight. We had a lot of information to cover. So we've got Carrie and Kimberly, who are going to tell us about the IPL Frax.
Hi, everybody. So Carrie's going to demonstrate here on our model Amber, but we're going to start first with the IPL portion of things. IPL is a non-ablative light energy that is used to treat sunspots, photoaging in the skin, the darker chromophores in the skin. And it's great for even treating acne and rosacea as well. It is wonderful for light to medium complexions. And as far as a single session of IPL, which Carrie has started now, you will see results in lifting of the brown tones in your skin at about 50% when we are done, and at 30% of redness being lifted. We recommend 1 to 2 treatments a year with this. Prior to coming in, you do need to avoid the sun and sunless tan lotions, as this light energy is attracted to pigment. It would see those, and that would be a complete contraindication to what we want to achieve. We also do not want to use any retin-A, alpha hydroxys, things like that. If you're prone to cold sores, we do recommend a cyclovir prior. For comfort during treatment, we'll also make sure that we have you numb, which Amber numbed for about 45 minutes prior to beginning. And then you'll see with what Carrie's doing here, there is an ultrasound gel put on the skin, which is a protective barrier while we are treating. The other thing that will, following treatment, what we'll see is the skin will be a little red. You may have a little swelling that can last 1 to 3 hours if we were doing just the IPL by itself. If we are combining it with the Frax, which we'll be doing tonight, it's 2 to 3 days of that. The IPL itself will actually lift the pigment to the surface of the skin, and we liken it to that of coffee grounds being kind of packed on, or darkening of freckles that you'll see come to the surface. So if we start to see that, it's typically on the face, it lasts about a week. If we're treating body parts like your chest, your arms, your hands, because we can treat other areas, you can expect 2 to 3 weeks before that's fully lifted. So following that, we oftentimes recommend you come back and we'll do about a week later our Microderm or a Dermaplane facial to help move that process along for you in a safe fashion. It's also great following the Frax, which we're getting ready to demonstrate next, in order to kind of put some hydration back into the skin too.
Yeah.
And then as far as Frax, it's also a non-ablative treatment. It's a 1550 nanometer wavelength of light. What that'll do is it'll help to resurface our skin. It's there to improve the texture, the tone, the clarity. It'll help with wrinkles. It also helps with some types of acne scarring as well. What it does is it delivers small bursts of heat energy into the skin to stimulate collagen, but it leaves the surface of your skin intact and it makes it for a much easier healing time as opposed to some of our ablative services or other types of lasers. Following still the same types of things with mild redness and some swelling for about 2 to 3 days. We do have a cool cloth on Amber here because we did start this side first, and that's something we would recommend you do immediately after, and you can continue that at home as well. You can get some mild peeling with this. So more like dry flaking of the skin for the most part. Oftentimes when we see the peeling start, it comes from around the mouth and it's working its way back to the hairline.
Hey, Kimberly, how long before IPL and Frax do you want to avoid tretinoin?
I'm sorry, Amanda, I could barely hear that.
Oh, sorry. How long before IPL and Frax do you want to avoid tretinoin?
For a full week.
Okay. So a full week on that. I love the IPL Frax as a treatment. I think it's incredible. Like she was saying, like you get such good results and you don't have as much of the downtime. Kimberly, let's talk about some of the areas too that we treat with IPL that's not just on the face.
So like I mentioned earlier, we'll oftentimes treat face, neck, and chest. And then we've also done the backs of hands, arms, legs are also great with the IPL. We can do the shoulders, which is a big one for a lot of people as well.
Yeah, my shoulders, seeing the dramatic difference of like, you know, too much sun. As a kid who grew up in the 80s, or we, you know, did baby oil and we shouldn't have, and definitely helped remove that sun damage, because really our face, our neck, and our hands are always exposed to the elements. So keeping them looking young is important for our overall aging.
And it's nice too, because you get that those sunspots lifted off the hands, and then you can also do fillers to give them a little plump look too, to make them more youthful.
Yeah, Erin just shared a photo of before and after of hand filler that is a beautiful result of how exactly that same thing they did IPL and then they did filler is beautiful. What would be what do we talk about for a series of the IPL Frax, Kimberly?
So what I suggest is 1 to 2 treatments. If we are treating rosacea for the skin, which is something that is a lot of the redness in the skin, we typically want to do that in 2. because more often than not, we're targeting the bulk of any discoloration and the sun damage, sunspots the first session, and then we can get a little bit more into the red tones by the second session. So it kind of depends on what we're treating. With Amber, we're targeting the reds today, so we'll probably recommend a second at least of the IPL.
Awesome. Within that space, we were going to talk a little bit too about microderm and dermaplaning and how they go hand in hand with this treatment. I feel like, especially as those coffee grounds start to come up and time to resurface.
And as she's healing from the Frax component of this too, she's going to have that mild peeling and flaking. So that's where Microderm and Dermaplane will come into play. If you have the red tones like we're treating here, dermaplaning would be ideal because we don't want to disrupt those capillaries as we're trying to repair that. So Microderm is great for all skin types, except for those with really red rosacea prone skin. So we have dermaplaning as an option there. It'll also allow us to really get in there and give you that hydration back while your skin is healing. One thing I do recommend too is really taking in a lot of water prior to your appointment, especially when doing Frax, because it does target the water in the skin. And so we want you to stay hydrated. We also would like you to continue that hydration while you're healing.
Yeah. Some of the questions are like, what about, you know, combining lasers with filler? What's the best, like, which one should go first or last? And really that comes down to like a personal consultation. And this is where you would meet with your service provider and say, okay, I know I want to do this specific filler, and I really feel like I want to do this laser. And then you create a treatment plan of like why we're going to do it in that order, specifically for your skin, because we can tell you, well, yeah, we're going to do this about a month apart or what that looks like, but really let's create a plan specifically for you and what your specific skincare needs are. We know it's a lot of information, peels and lasers and fillers and which lasers are going to be best, because when you listen to it, all of them sound good. You're like, yes, I want to do them all. I'll do them all tomorrow and I'm going to look like I'm 25, right? Like that's what we all think, but really we want to look at your skin and be able to make a plan for you. So those consultations are so important, just so we can make a custom plan for exactly your amazing needs.
I agree with that. You do want to customize it specifically to each client because everybody's going to be a little different with what they need. Just because your best friend had an IPL Frax doesn't mean that's for you. We may recommend that it's just an IPL. Depends on your actual need for what you're trying to achieve in your long-term goals with your skin. Oftentimes too, when we're talking about fillers, like you mentioned, in conjunction with lasers, people want to know if they can do them on the same day. If there's a lot of heat being built up in the skin, we typically would not want to do them on the same day as far as fillers are concerned.
Yeah. I mean, it's definitely worth making the treatment plan and following the plan so that you get that best long-term results for the longevity of it. IPL Frax too. We talked last night about peels and layering peels, and we talked about how peels are a great in between treatment, you know, or maintaining lasers. I feel specifically too with IPL and Frax that peels are a good long-term or in between maintaining that laser. Would you agree with that, Kimberly?
Absolutely. And yesterday, the girls were on talking about the peels, and I agree 100%. I think that is an excellent way to keep that sun damage at bay. It's a great way to keep those fine lines and wrinkles going in the right direction. And then annually, you'll pop in there with the laser services. So they're great in between, not just Microderm, not just Dermaplane, but we can even combine those peels with those services too.
Mm-hmm. Well, and you know, they do different things, which is what is amazing about what we get to do. Like fillers can help make us look more hydrated and fuller where we've gotten a little bit older and lost fat, but then your skin, right, is still what is holding everything in. We need to continue to build that collagen and elastin to maintain that on top of that. And then we don't want to have, you know, crepey skin that's, you know, sagging if once we're all lifted and all the things. So it's all about maintenance and just keeping that aging gracefully in a way that feels good to everybody.
Exactly. And everything is based on seasons in a lot of ways, but there's a lot of things we can be doing year round. So it's really important to do those consults so you can get that full program of A, B, and C needs to fall in this time of year, this time of year, or this time of year, based on what you're looking to achieve, obviously.
Yeah. What would be your biggest advice as far as skincare when it comes to, because we specifically talk a lot
Following
about
this?
discoloration. Yeah.
Yeah. So what I would suggest is immediately after, always just using a gentle cleanser. We also recommend the epidermal repair, definitely sunscreen. And we do have products if you're specifically targeting discoloration. We have a prescription hydroquinone we could be doing. We also have our discoloration defense from SkinCeuticals as well, but also always, always, always vitamin C. And I think everybody that works here would always say, if you're not on vitamin C, you're not doing your best with your skincare.
Yeah, that antioxidant is so incredible when it comes to
It's
correcting and protecting.
very much
It's
so.
both. It's both of those things that are important. And especially in Colorado, that sunscreen is like it is the golden ticket right there in prevention when it comes to aging, for sure. Anything else we should know that maybe we missed, Kimberly?
I don't know if you wanted me to cover any of the cost of things on the promotions
yeah.
that we have going. The IPL is combined with a microdermabrasion. If we're treating face and neck and it's $425, you'll save $100 on that.
Yeah.
And then if you're doing IPL with the Frax, like we demonstrated this evening, you'll do face and neck and it's $750, and that saves you $100 as well.
It's awesome. Thank you. Thank you. Thank you so much, ladies. As you can
Thank
see,
you. Thanks for
client-
tuning in, everybody.
Yeah, it's good. Thank you. It's, as you can see, we work really hard to make sure our clients feel very comfortable. The IPL Frax is one of my favorites for my skin as well. One of the first lasers I had ever done in a med spa setting was an IPL. And I was shocked at how much sun damage was there that you couldn't even see, but as it came to the surface, created such clearer skin, and obviously is protecting long-term effects, which is absolutely incredible to be able to have those options. I cannot stress enough, and I know we talk about it a lot, is coming in for a consult. And it just gives us the opportunity to really look at your skin and create a perfect plan that is meant just for you. And make sure that you are on the right path for whatever your skin and hair, health, hormone, whatever those goals are, that we can help you with that. And the maintenance. Hang on, let me see this. It depends on like what your skin is like, but I would say probably once a year maintenance IPL. Some people, they can do their series of IPL and they may be able to maintain that with a peel and help keep that sun damage at bay. It just depends on how much sun damage you've had in the past, I think, is really where we're at with that. I will say too, the team is so open and always wanting to answer questions. If you ever have questions, let us know. We'll be happy to get you with the right team member. And you know, I feel like I have shared a lot about my personal journey over the last few days. And I wanted to be able to do that just because I think sometimes that just brings things a little bit more forward. But please know that if you have questions about hormones or about the peptide program, because I've really done a lot of research in that. I'm not medically trained. I talk with Kathy about everything before we share, but I would be happy to share my story and support and do whatever I can to help you along your journey in that space as well. So just know that we do that. And I love that I get to see you guys here on this platform, but many times it doesn't make the correlation for me. So the next time you're in the spot, please make sure you introduce yourself to me. If we haven't met already, I'd love to say hello in person as well. All right, I have some giveaways, which is my favorite part. Before I forget, because I get excited about the giveaways. We're still continuing to partner with our nonprofit, the Alliance for Suicide Prevention of Larimer County. It has been an incredible partnership. We're seeing some amazing things come out of that. So you can go to the link on our website to donate, and your name will still continue to get put in for the drawing tomorrow night. And then tomorrow night, we have our first in-person since 2020. I get to bring out the red carpet. We're going to take some photos. We're going to drink some champagne. There's going to be some treats. We'll do a live drawing for that grand prize, which is $3,500 worth of services and products and giveaways. And then just celebrate this 5 years. The statistic, and I need to look it up specifically, but I want to say less than 2% of women-owned businesses actually even make it a full year. So I love that I get to share that my business partners and I and our amazing team, which we couldn't do anything without them, have been able to hit this 5-year mark. It's a huge milestone, I feel like, in our community, but also for us as a company, and we couldn't have done it without you. And thank you for your support and encouragement and continued love throughout the years. You make a huge difference in each of our lives, and we appreciate you very much. So please come join us tomorrow and come say hi to me and let's take a picture. All right. So I have an IPL face and neck to give away to Jenny Torgensen. Again, sorry if I say your name incorrect. I love when you guys come in, you're like, I won last night, what did I win? And I have it all here for you. And then what Kimberly was talking about, the discoloration products that are the best for the discoloration in the skin. I have a whole starter kit for that, and that goes to Elisa Bass. And that is gonna have your name on it and will be here for you to pick up. Vital Body, which is our CBD line. You guys, the CBD cream, that is the pain cream. I have never used something that is actually a topical cream that actually works. It is a staple in our household. It is, we would not live without having it in our household. It is amazing, and I travel with it. It is so great for everything. But we have a bath salts, which is great for pain. It's better than Epsom salts. It smells beautiful, and some CBD facial oil. Oil is incredible to use over like the CE ferulic, which is your antioxidant, because it helps seal in those antioxidants. That goes to Becky Bassos. I have a Maxi Brow, which is incredible for growing eyelashes and eyebrows. I use it all the time. That goes to Victoria Keller. Congratulations, Victoria. Upneek are the eye drops. I have used them tonight. You can see, look how bright and white my eyes are and open. I wanted them a little more open because we did a little darker, smokier look. And that goes to Megan Hartsfeld and Kieran Devaria. Those are for you. I have a swag bag. Our swag bags are our go-to. Everybody loves the swag bags, and that goes to Melissa Myers. An Aquas towel for hair for Paula Didario. And then Kamara Shanks, she is one of our VIP clients. She is a realtor here in Northern Colorado, killing it in that space. And she sponsored this week a Jack's Fish House gift card and Mary Mountain gift card. So you have dinner and dessert. And that goes to Christy Smart. Congratulations, Christy. And then I have a full-size CE ferulic, which is the antioxidant that we were talking about. That is so incredible, preventative and corrective. And that goes to Holly Osborne. Congratulations, Holly. So thank you all for joining me tonight. We're a little bit behind time. We went longer tonight. I had a feeling we might with hormones and vaginal rejuvenation and peptides. Peptides I knew would take a little bit longer, so we should have planned for that a little bit better, and we will for next time. But thank you for spending there's many of you that spent every night this week with us to go over demos and talk about the services that we get to offer here at Facetté. So thank you for spending your time with us and learning with us. And I look forward to seeing each and every one of you tomorrow. There were lots of questions about the recorded videos. I have sent them off to our marketing team. They will be on our YouTube channel, and you can find them through our website. I'm sure they're not uploaded just yet, but they will be, so that we can continue to refer back to them, and you can share them with your friends who you want to share those things with. So, and just because you didn't win tonight, or maybe don't win the grand prize, I still have a list of 20 plus items that we are drawing for after the party tomorrow night. So when you come tomorrow, you can put your name in the drawing again. Every time you're on a call, your name goes in, or if you donate to the nonprofit, your name goes in. The girls spent a good amount of time today putting all your names in to the drawing. I need to find a bigger bucket, is what I realized today, to draw from tomorrow night. So I've got to find a big old bucket, and it's going to be great. So thank you all. Yes. Oh yeah. Tomorrow night I will, of course, thank you guys so much for joining us. It really is very special. yes, tomorrow night, the live, the grand prize drawing, everybody's gonna be here. I'm gonna find a place here in this one. I have no idea where. You know what I'm gonna do? I'm gonna bring my computer out. I'm probably gonna put it on the front desk. We're gonna pull up a live Zoom and I'm gonna have my bucket of all the names. And we're gonna pull a name for that grand prize drawing right then and there, so everybody can see. You do not, the question has come up so many times, you do not have to be present to win. We recognize that life is busy. There are so many events. Tonight, Heyday has an event going on at Heyday. Tomorrow night after our event, the Life and NoCo event is happening. So we know that there's on top of life events and kid schedules and everything else. So we know there's lots going on. You do not have to be present to win. If we draw your name and you don't know, we're gonna still call you and let you know that you won and put that on your account, and you'll still have access to that. So it is still gonna be all for you. Yes, tomorrow night. Oh, thank you, Irene. Oh, thank you for joining us. Good to see you. Tomorrow night, we start at 4. So my plan is to hop on and do the live drawing around 5. So somewhere kind of in the middle of the event. That's the plan. So between 5 and 5:15, hop on, and the link is still on our website, and I will pull up the computer and we're gonna draw some names and we're gonna cheers and have some champagne. So I appreciate each and every one of you. Thank you, thank you, thank you so much. Hi, Mama. My mom's been on this week. It's been fun this is her first Zoom, and I saw Holly today. Christine's been on every night this week. Thank you so much, Christine and Barbara. I love when I get to see everybody's face, and Barbara's been on every night cheering me on. She's my buddy. Every time she comes in, we just have so much fun. So I appreciate each and every one of you, and just want to say thank you for being a part of our Facetté family. So have a wonderful, lovely night. I'm going to go home and get some sleep so I have enough voice for tomorrow, and we're going to rock out this week and have an amazing week as we go into Valentine's next week. So thank you all. Love you lots.